Well, after some anxious months awaiting COVID vaccine delivery, it seems South Africa is well on track to hit even higher than 300,000 jabs a day. That target, of course, set by the president. 2.8 million additional Pfizer doses are due to touch down tomorrow. Now, that, of course, is part of the 500 million doses donated by the US government to poorer countries. That's going to be channeled through COVAX. Well, I'm joined now by Professor Krista Johnson, Director of the Center for African Studies at Howard University. Prof, thank you so much for your time. It's great to know that South Africa is getting sorted. We're doing a lot of daily vaccinations. But does South Africa really stand alone at this point in terms of the continent when it comes to a high rate of vaccination?
Already, from probably in the last month or so, the vaccine rates in most of the developing countries and certainly throughout the African continent have been extremely low. 90% of vaccinations have gone to the developed world. And so we have a lot of catching up to do with regards to African countries. But there's going to be a challenge there because there's a lot of vaccine hesitancy in a number of African countries. A number of African countries don't have the kind of are not seeing the kinds of spikes that South Africa is. And so you don't necessarily feel there's not the demand or the expectation that the vaccines are actually something that is necessary or required. So I think it's going to be a long uphill battle in terms of getting the entire continent vaccinated. COVAX is a great start, but it'll be interesting as well to see what the negotiations in the WTO are going to lead to as well.
Yeah, so I think a waiver on the intellectual property might assist, certainly for future waves or future pandemics. The WHO has said they are clear that there's a serious undertesting on the African continent. And it seems that, you know, if you look at Nigeria with over 200 million people, they've recorded only 2,000 deaths from COVID-19. Do you think that's a classic case of just not collating the data? I mean, if you compare it to South Africa, we have about 56 million South Africans, and our official deaths is over 70,000, but some are saying it's probably 3 times that high. So we have a data problem in Africa, don't we?
I think we do have a data problem in Africa, but actually in other countries as well. I think we have to have some consistency when it comes to responding to the COVID pandemic. So in South Africa as well, it's not simply in, the numbers of positive cases that we have, but also looking at the infection rates. And the positivity rates of the tests. So I think one of the things that South Africa is making the rest of at least the industrialized world a little bit nervous on is the high numbers, the positivity rates among testing, which suggests that there's a lot more COVID in the community, which is not actually being caught by the tests. But I think that the problem with that is that we have to have some consistency, because we see this in terms of, say, international travel and other kinds of trade regulations and requirements, where countries are now kind of coming up with their own policies with regards to COVID, and they can be based on wildly different data and statistics or statistical benchmarks. So I think that it would be useful and behoove certainly the United States to take the lead in this regard.
It's interesting, you know, the phrase vaccine nationalism was coined really early, even before we saw it actually happen, with Africa really left behind. And now what we're seeing, you mentioned travel, you know, for example, in Britain, we've got red, amber and green countries. And even if you have been vaccinated with an approved vaccine, you can still be on the red list just because you're part of Africa, which is what South Africa is being faced with. Inevitably, where do you think this is going to leave Africa economically? Do you think that we are going to be more disadvantaged than other countries because of the slow vaccine rollout?
I think it is likely that there'll be significant economic, fallout and implications from COVID, even if it doesn't spread at the tremendous rates that it has spread in the industrialized world, precisely because of the issues that you're saying. This kind of, what one might call it almost the racialization of risk, where, you know, Africa, the African continent now again is painted in this light of being a risky investment, a risky tourist destination, etc. So I think even, you know, despite where COVID lies or where the numbers fall with regards to COVID, it's not going to be a good scenario for many African countries.
Thank you so much for your time this evening. That was the director of the Center for African Studies at Howard University, Professor Krista Johnson.